this video, I'm going to be talking about some of the pros and cons of nuclear medicine technology. Hi, my name is Ashani, and I recently became a certified nuclear medicine technologist. I thought I would make this video just to highlight some of the pros and cons of working in this field. Every single job has pros and cons. These are just the ones that I have personally found to be true of nuclear medicine. Just a small little disclaimer before we get started. This is a video talking about what my experiences are like working in both a clinical setting and the didactic part of my curriculum. I have been working for the past several weeks as a nuclear medicine technologist, so I'll be adding in those experiences as well. So let's get started. My first pro of becoming a nuclear medicine technologist is that it is such an innovative field. There are constantly new radiopharmaceuticals that are being researched. What this means is that the studies we do like 10 years from now may not be the same studies we're doing now. A really good example is a new radiopharmaceutical PSMA that's being used on patients with prostate cancer. And of course, this means that we have to be educated on what these new radiopharmaceuticals do and new imaging techniques. And this is just really incredible because I really enjoy learning, and I love the fact that my day-to-day always looks different, and that in 10 years I may be scanning a pharmaceutical that is just completely unknown at this point. Even though there are new radiopharmaceuticals in research, I will say that this doesn't have an effect on jobs, which is my first con. The job market isn't big, nor is it the best right now. I feel like nuclear medicine jobs kind of go through waves where for a little bit, you'll be able to find a full-time job with a hiring bonus. All of my classmates were able to find jobs. Not all of them are full-time, most of them are per diem and part-time. And this of course depends on where you live. If there's not a school near you, I find that it's easier to get jobs. I live an hour and a half away from my school, and I was able to get a job no problem. But my classmates that lived closer to the school had a harder time finding or securing a job. If you are considering this field, a good idea would be to just go on a job website like Indeed.com or Glassdoor and look up nuclear medicine technologist and put in your city, see what comes up. That way you'll have an idea if you'll be able to find a job after you graduate. Another thing about the jobs, and I think this is between like a pro and con, is that a lot of people work in this field until they retire, meaning that it's a job you can get old with, which is great if you already have a job secured, but it's not so great if you're looking for a job, as a lot of the positions have already been filled by people who've been there for like 20-30 years. Just something to keep in mind if you are looking to get into this field. So even though it's not the best job market, I will say another pro is that the jobs that you will get pay a lot. Nuclear medicine is one of the highest paying modalities in radiology, and it's very nice because the barrier to entry is an associate's degree. Of course, depending on where you live, salaries will fluctuate, but the lowest that I was offered was $30 an hour, and that was the lowest. And because of where I lived, I had negotiating room to increase that offer if I wanted. The highest I think that I heard of in my area was a per diem job. I want to say it was like $62 an hour. So again, depending on where you live, you can make a lot of money. And of course, you can go into traveling and you can make a lot of money. Another con is that you will be dealing with radiation, and it's not like the machine will give off any radiation. It's the doses that you're handling in your hand will be giving off radiation. Because of this, the exposure to nuclear medicine technologists are generally higher than almost any modality in radiology. I know that people who work in interventional radiology also tend to have a high badge reading, but nuclear medicine, it can get pretty high. Of course, there are a lot of laws to regulate how much exposure you can receive in a year, and even within that, we try to stay within 10% of what's allowable. So there's always checks to make sure that the amount of radiation you're receiving is not in an unsafe quantity. But I know a lot of people that are very scared, and as you should be, of radiation exposure. It's funny because I find the longer you work in the field, the less scared you get, and the more you are to like not wear your gloves. I just want to make it clear that even though might be working in this field 20-30 years, you're still dealing with radiation exposure on a daily basis. Let's see, another pro is that you will probably have a pretty nice schedule compared to what most healthcare workers have to work. Now, this can be a pro or a con depending on what kind of shift you like to work, but most technologists work 8-hour days, 5 days a week, if they're full-time. This can be nice because you're working during normal working hours. So you'll be home, like let's say you have a family, you'll be home when they're probably home, and you'll be gone at work while they're already gone at work. Like I said, this can be a pro or con. I honestly like working odd shifts, so it's an adjustment to work during normal working hours. Unlike other jobs in the healthcare world, this is a pretty safe bet that you will be working during the day. Even within radiology, like CT, MRI, ultrasound, they often have like graveyard shifts and swing shifts. Nuclear medicine, you don't really see much of that. The exception to this is nuclear medicine technologists that work in a hospital setting will probably have to take call. The way call is divvied up depends on the facility you work at. Some places do it where you have to take call for the full week. Some places have a designated person that takes all the call, and some places say you will do it one day, this per diem person will do it another day, another full-time person will do it another day, and we'll divvy it up on a day-to-day basis. Just so you know, that's something you might have to deal with if you work at a hospital. The next con I'm going to talk about is probably what sets most people off of the nuclear medicine technologist path. There's a couple people in like the radiology world and just out in general who have heard about nuclear medicine technologists, and when I ask why they didn't go into the field, they actually have all cited this reason. And that reason is that they are afraid of needles. What's the name of the phobia for needles? Hold on, let me look it up. Trypanophobia. I don't think I'm saying that right. If you have a fear of needles, this may not be the best field for you. I worked at a hospital pharmacy where I had to compound sterile medications with like a laminar hood and everything, and I had to use needles all the time. I didn't have a fear of needles. Some people in my class were hesitant to start with needles. I know technologists that had said the same thing, that they didn't like needles. It's not that they had a fear, they just didn't like them. As most people don't like needles. I think that's a completely normal thing. But in nuke med, you will see needles everywhere. You're probably gonna have to start IVs. Even if your facility doesn't allow you to start IVs, if it has to be started by a nurse or an IV team, you're going to be handling radioactive material that comes in syringes that has needle caps on it. Nuke Med might be one of the few places other than pharmacy that you still have needles to work with, because if a dose is too radioactive, then we want to be able to manipulate it in such a way that we can reduce the amount of exposure. Say we have a patient that's pregnant that needs the scan done and we have to reduce the dose, there has to be an easy way to manipulate it such that we're not giving them all the dose, but we have to be able to contain what we don't use because it's radioactive. We don't want to just release it everywhere. Hence, we're allowed to use needles. Honestly, starting IVs at first was difficult. Now it's just a part of life. Most nuke med techs are really, really good at starting IVs, because I would say 90 to 95% of patients need an IV started in order to inject the radiopharmaceutical that we use. In my case, 100% of my patients need IVs. I'm the one who puts them in. Again, if you have an intense fear of needles, probably isn't the best field for you. But I will say that I pass out almost every single time I get blood drawn, and I feel completely fine and comfortable injecting other patients. It's different when it's not on you. I'm gonna wrap this video up by saying a pro that literally every single healthcare person, every single video I watch about healthcare, radiology, nursing, everyone always says this, and it's that you are going to meet some of the most incredible people in your life. I can guarantee it. Every single healthcare person says this, and I think it's because your patients that you see are not people that you would ever meet in a day-to-day situation. And these patients are often very vulnerable and they have a lot going on and they will confide in you. They're probably scared, and to be there and nurture them and get to know them, have a lot of empathy, it's one of the most rewarding experiences ever. If you're going into healthcare because you want to help people, I think that nuclear medicine is a great way to do it. You're getting to know people and you have an active part in their healthcare by starting IVs, doing their scans, but it's not so hands-on that if you have a really, really tough patient that for 12 hours it's gonna wear on you. So you will see really great people for just about an hour or so, and if the patient is not that nice and not that cooperative, it's just for an hour. So those are my pros and cons. Let me know if you have any questions or if you can think of other pros and cons in the field that you're in. But thank you so much for watching. I hope this helped out a little bit. Take care. See you in the next one.